US healthcare system is broken because we've been following the same recipe for the past 100 years. And this recipe is the one that we use to create doctors. We still use it. It's hyper-focused on memorization and regurgitation of medical facts. For those of you who went to medical school in this audience, I hated it. It was my worst educational experience in my entire career. So I wanted to hack this century-old medical education system that's stuck in the last century. So how did I do it? I started a design thinking program for medical students 2 years ago, the first one in the country specifically for medical students. We follow them we start with them during year 1 and we follow them through year 4. And what we do is we bring in designers into the hospital and we work with architects, service designers, industrial designers. They think differently. They even look a little bit differently. I wear blue pajamas. They tend to wear black. And we've met in their spaces. So we go to architecture firms. We go to maker spaces. We go to design companies, and we co-create and tinker and collaborate with them. I like to take my students out of the classroom and put them in the messiness of our healthcare system. And I give them challenges like this one. How can we improve the patient and provider experience in our busy primary care clinic? And we start off with empathy building. We have students interview and observe doctors and nurses and patients, the receptionists, people that we normally wouldn't think of. And we do this so we could find what are the true pain points and how we can problem solve with those pain points. Like this pain point right here. This is an exam room where it is impossible if you're a provider to actually look at your patient. And if you're a patient, it's terrible. You're sitting on this tall stretcher that's uncomfortable and looking at the backs of your doctors as they type in the electronic medical record. So how can we redesign this? Our secret sauce to creative problem solving is prototyping rapidly. And prototypes don't need to be high tech. Prototypes really just give form to our ideas. And they're often low tech like this. It's a simple sketch of a redesign of a clinic exam room. Or prototypes can look like this. It's a mock-up of a smartphone app that helps doctors take more accurate medication histories from their patients. We give students the tools of designers and makers. And they range from fun things like Legos and glue guns to high-tech things like 3D printers. And we do that so they could prototype rapidly and iterate. I think this gives future doctors the ability to collaborate. Monica Wittig said yesterday morning, making leads to collaboration. And we found that in our program. We've been able to co-create with patients, physicians, and designers. And I think this is changing the way that future doctors will be able to communicate with their patients.